contour of the abdomen, we said you need to look at it at eye level to be able to, Ruby, to be able to see the actual contour. So if you're looking at this, it would look like it's scaphoid. But if you're looking at eye level, you'd see that it's flat.
And it's pulsating.
Okay, yes, because she's slim, and so the pulsation from the PMI will be reflected over the abdominal area. Okay, so we note the contour, it's flat, and then you have to stand at the head of the bed to be able to observe the umbilicus with regards to its location. Is it centrally located? What is its appearance? Is it inverted or everted?
Inverted.
Inverted.
Oh,
Okay. What is it like?
I didn't know you were asking us. Okay. Yeah.
Okay. All right. So it's inverted, and she's female. Do you see any Collins sign?
No.
No. Okay.
Really
Then
clear.
There's no ectopic
Really
pregnancy.
clear.
Okay. Then we ask the patient, "Can you please lift your head off the bed?" Okay. So when the when the patient lifts the head, the abdominal muscles will tense. So you will see if you have any masses, any pulsations that you may observe. So you're still standing here at the head of the bed. Okay. No masses. No masses. There's no separation of the muscles, and we call it diastasis recti. Don't worry about that. Okay, there are no pulsations other than from the PMI. It's over on that side. Okay, and then the next part will be to check the stool, if there is a stool sample, and the emesis. Okay, after which we do the auscultation. So when we auscultate, we start with listening to the bowel sounds, and we do all 4 quadrants. So like we said, okay, we use bell or diaphragm?
Diaphragm.
Okay, so you use the diaphragm listening to these different areas. So go from one area to the next. What is our normal bowel sound per minute?
30. No,
No,
5 to
5
30.
5 to 30.
That's in minutes.
5 to
30.
30.
Oh, 5 to
5
30.
to 30.
50.
I don't know.
Like I said, in some books it goes up to 55. So
Yeah,
we'll
see?
just be consistent with 5 to 30. Okay, so we listen to the bowel sounds about 15, 30 seconds in each. Because if you don't hear here, go to the next, and the next, and the next. So it's not only one area, and then you say, okay, she has absent bowel sounds. Because depending on when she last ate, you may not hear the bowel sounds. Okay, you may hear it more here if she has eaten like 4 or 5 hours ago. But if she just ate, you may hear the bowel sounds more on the upper, because this one will be the more active area. Okay, and then we listen for the vascular sounds. So first for the bruit, what is this artery that we listen to here?
Aortic.
Okay, so this is the along the mid-epigastric area,
Iliac.
iliac,
Renal.
renal. Okay, and then here,
Umbilicus.
huh?
Yeah,
I
we
know,
said-
but what do you listen for here?
That'd be something.
Oh, you listen for the
The what?
No, just kidding.
Oh,
Oh, the humming, the
what humming?
the Venus humming.
The venous hum.
Okay.
Right
Okay,
here.
here,
Okay.
along the
Okay.
umbilicus.
Okay.
Okay, so aortic, aortic, then you have the iliac, renal, and the venous hum along the umbilical area. Okay, so after that we do our, what's next? Our percussion. Yes? No?
No.
Yeah.
Wait, after you
Percussion,
ask.
abdomen, all
Yeah.
4 quadrants, yes.
Okay. So when we percuss,
Listen.
so like we said,
Right here.
we divide the abdomen into 4 quadrants. So when we percuss, excuse me. Okay, thank you. Okay, so we start here. 1, 2,
So those times we need brandy for class.
Right.
4, 5, 6,
I
7,
feel it better.
8. Do you hear the sounds? The
Yeah.
difference in the
Mhm.
sounds? 8, 9, 10, 11, 12, 13, 14. So you
So
go
that was like
1,
more hollow.
2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14. So this is the percussion. So you will listen to the timpani, the areas where you feel the dullness. Okay. Now, after the general percussion, we do the
Liver span.
liver span. So we said for the liver span, one of the landmarks will be along the mid-clavicular line. So, along the mid-clavicular line, okay, below the umbilicus, you start your percussion. Okay, so percuss until you hear a change in the tone.
Right there.
Okay,
Right
so
there.
here, you now mark it. Okay, now from below the inferior border of the breast, it's going to be a little difficult, but
Right
Right
there.
there.
okay. So, and then we measure it.
Between
Has to be 6 to 10.
12
right?
to 12.
6 to 12.
6 to 12.
So from here, about 6, little less than 7. Okay, so that is the normal liver span on the right mid-clavicular line. And then along the mid-sternal line, same thing, from below the umbilicus. Mark it. Just move it. Okay. And then from the inferior border along the mid-sternal. So here.
What's this one?
Man, your person's really gonna have to give like,
Okay, so you have about 4 to 8. Yes, so it's about 6 centimeters. Okay, so this is for the
and that should be 4 to 8, right?
it's 4 to 8. So that's for the mid-sternal line liver span. Okay, and then we do now our splenic dullness. So, do you mind moving this? Okay, so for the splenic dullness, our landmark will be the mid-axillary line. So if this will be the area where you have the 5th ICS, go down a little you for the 9th ICS, and then you now percuss. Okay, so basically this area is where you hear the splenic dullness. This area here will be less than 7 centimeters if you want to measure. This is because the 9th to the 11th ICS will be less than 7 centimeters.
So anything more would be that means your splene's enlarged, right?
Mhm.
Okay.
Yes. And then we now do the splenic percussion sign, the Castle sign. Your landmark will be the anterior axillary line. So this time here, you ask your patient, can you please take a deep breath? It. Can you hear the timpani? Okay, relax. Okay, so here is where you hear the timpani. There is no dullness within the area, so that means the spleen is not enlarged. Okay, then we go to the percussion of the liver and the kidneys. So here the patient will need to sit up. Can you sit up for a while and dangle your feet here? Okay, so this is not okay. So put your hand on the right, just below the right costal border, and then 10 minutes. Okay. This is her 12th rib. This area here is where you have the flank, the costovertebral angle. Any pain? Any pain? Okay, so that's the liver, and then you have the kidney, blunt percussion. Okay, and again. Right. And then we do our palpation, correct? Okay. Oh, when we do our palpation, okay. When we do our palpation, again, we follow the, I was going to point because I had the diagram there. The diagram when you do your percussion. So you have the 1, 2, 3, 4, that same diagram. So again, we said, you will combine the light and the deep palpation. Your dominant hand will be in contact with the skin. Now, if for example, you're doing your palpation and the patient starts, it's very ticklish. He starts
Wait
giggling.
until the last.
What do you do?
Oh, if they're ticklish, you just.
What can you do?
Okay, so what can you do is let the patient put a hand there and then curl your hand over. So you're doing your. It's not going to be as effective if you were doing it, but you know, there's no way because there are some people, no matter what you do, they will be and you will not be able to palpate very well. Now, if for example, the patient's not ticklish, but whenever you touch, the patient tenses.
Will it last?
No, it's not. There's no pain. She just tenses because you know